Hi, it's Lainy here at Achievement for All, and I'm joined by Laura Stagg, one of the charity's achievement coaches who works in a lot of schools for us. And Laura's here today to talk to us about something called ACEs. And I don't know whether you've heard about that before. Sounds a bit odd. So Laura, welcome. Talk us through. What does this mean?
Thanks. So ACEs is an acronym. It stands for Adverse Childhood Experiences. So it's experiences that children or young people might have experienced, such as trauma, neglect, abuse, mental health illness, either themselves or within the family, domestic violence, substance abuse, maybe community violence as well, or gang-related violence. And then there's a growing body of evidence to show how this manifests. It might not start showing up until adolescence, but it does. There is a growing body of evidence now that shows that this has a really long-term detrimental effect on people's health and well-being.
Wow, so this is some pretty big stuff we're talking about. So how do people manage this in an educational environment?
Yeah, so it's really challenging. I think the first thing is really having an understanding of ACEs and making sure that staff have CPD around it, understand what it is, know how to look for signs of it as well. So we know that the research is starting to show now that if you have 4 or more ACEs, your life chances are significantly impacted. So it really is quite devastating stuff. It's looking at the likelihood of you having cancer as you grow older, heart disease, and early death. And it's also quite a nasty little cycle as well, as you can imagine, because once that starts happening, obviously if you're having an early death, then that might leave your children then as well with an early bereavement and loss of parent or carer, mental health illness. So it can become a bit of a vicious cycle. So as much as possible, we want to nip that in the bud and be that person that can support it and make a difference.
Okay.
I guess the challenge is, as we've alluded to,
I think that the sound went a bit funny. So what can people do? So what will those colleagues in schools be able to do to support those young people?
Yeah, so again, I think it's important to recognise that we are working in education and we can't fix everything. So when we're thinking about housing, about knife crime, gang violence, we can't be expected to necessarily stop that completely, but there are things that we can do to reduce that and also then to support the impact of people who already have experienced it. Very often we might get children coming to us mid-phase that have already had those adverse childhood experiences, and we're doing the mopping up then and looking after them. So I think supporting the whole family is really important, because those adverse childhood experiences aren't just going to sit with that one individual. We need to look at the siblings, the family, and how we support them as a whole. We need to make sure we're working with lots of different agencies as well. So making sure we're working well with social workers, virtual schools if they're involved, counselling services, and getting the right support in for those people as well. And then we need to make sure safeguarding procedures are really tight as well. So making sure we're identifying any of those adverse childhood experiences and following guidance as well.
Okay. And I suppose, one of the things, again, as I was saying before, that, I work with the older age group, and in the older age group, sometimes those things, behavioural or whatever, don't manifest until adolescence, because obviously we know there's lots of changes in adolescence. So often I can be with college lecturers and we're talking about it, and they'll say, their behaviour is incredible, it's changed, and the school said they were never like that at school, and it's only since they've come here, and they don't fully understand it. So I'm just wondering, if you noticed some behaviours, what are maybe some of the behaviours we're looking for that might indicate we need to look a little bit deeper, or we need to be aware something else is going on? Because we always talk about behaviour as communication, don't we? But what are we looking at?
Yeah, so I think that's a really good point, that all behaviour is a form of communication. So as challenging as it sounds, we're looking for all behaviours. It can be a really wide range. You might get some children or young people or adolescents who are very withdrawn and quiet, and maybe they're not talking much, maybe they don't seem particularly happy. They might be sort of coasting by, making minimal progress or less than expected progress. And then you might have some very overt behaviours as well, who might catch your attention a bit more. They might be desperate to be recognised and for someone to see them and to know what's happened to them. So that might be more of the swearing, it might be the outbursts, it might be physical violence, it could be substance misuse, it could be self-harming, it can be a real range of things. So I think it's really important, if you think about that iceberg effect again in the behaviour and communication, think about the behaviours you're seeing on the surface, and that can be a whole range of behaviours, and then thinking about what's going on beneath that surface, what things might have possibly happened. And I think the most important thing is to understand that all behaviour is a form of communication, and to really try and empathise and understand, not necessarily, you don't have to necessarily understand exactly what they've been through, but understanding what they might be feeling is really important, and validating those feelings, that they might be feeling guilty, they might be feeling shamed, they might be feeling angry, they might be feeling rejected, and empathising with that emotion is really important, and just showing that you understand them as an individual, and that you're not judging them because of that emotion or because of that behaviour as well. I think with the behaviours as well, especially those more overt ones, having a clean slate every day with that young person is really important, and trying to distance itself from what you're doing, knowing that they've got things going on for them that they're dealing with, and it's not a personal thing for you.
Yeah. And I think that personal thing is really important. I think, particularly with, I think any child can be, very difficult. The older they get, I guess, the more threatening that difficulty might feel to you. And you do have to not take it personally, because actually it isn't about you, is it? It's about the turmoil, I guess, that's going on inside them. So you need to kind of distance yourself from the feeling personally attacked, don't you?
Yeah.
And then kind of recognising that, okay, that there is something going on for them. And I love the idea of the clean slate, Laura. I think, my goodness, that's so important, because they can have a really, really bad day, can't they? And then if you take that into the next day for them, you're actually starting their day in a bad way for them, aren't you? Whereas you could actually start it from a positive aspect again the next day, can't you?
Yeah, which again comes down to self-regulation. So, it's really hard when you have a lesson or a tutorial go like that. So taking that time to look after yourself, identifying the emotions the young person's feeling, and knowing that that's okay, and having that clean slate the next day. I think the language you use with the young people is really important as well. So very often when I'm working with my teams, I'll ask them to think about the most challenging person they're working with at the moment, and maybe write 3 words to describe them. And very often manipulative, angry, devious, those kind of words might come up, and I just think, have a think about how you'd feel if someone was describing that about you, and what impact that would have on you. How can we change those words around and try and reframe our understanding of those young people and think about them differently? I think also we're thinking about one end of the spectrum where we've kind of got maybe older adolescents who are presenting the behaviours, but we don't know the trauma that's gone on. At the other end of the spectrum, we can sometimes have a very clear understanding of trauma that's gone on. So I've worked with settings before where we've got children who have lost a parent or carer, or they've gone into care themselves, or they've suffered a really traumatic event. And the school or the education setting might think, this is great, they seem to have bounced back really quickly and they've gone back to normal. And you have to say, oh wait, hold on, that might be the case for the moment, but that incident still happened and there's still stuff going on. We're just not seeing overtly yet. So what can we put in place proactively to make sure that when those things do start coming out, we've got the right support in place, because they are still going to need to deal with that event.
And yes, and little children and younger children, they probably don't have that full comprehension of it yet, but as they're growing and their brain is developing, they probably then gain it, don't they? They understand what's happened.
Absolutely. There might be the cognition, or they might not have the language yet to express it. Yeah. So making sure that we're modelling those languages around emotions. We can use role play, stories, circle time, anything like that, to really help them process those things and understand the emotions that they might be feeling and validate them.
Yeah. Okay. I mean, this is a very in-depth subject, isn't it, Laura? And something that if somebody was genuinely interested in doing some CPD or some coaching or just learning a lot more about it, probably needs to contact us or one of the specialist organisations in order to have that additional information, because it's an area that you really need to understand, don't you, in order to do a good job for those young people in those situations.
Absolutely. So our Achieving Wellbeing programme and our Achieving Wellbeing Children Looked After and our Emotion Coaching programs are really good places to start with that CPD and that understanding around this work. And it's a growing body of evidence. There's more research going on all the time. So I think it's important to stay up to date with that and understand it.
Yeah, and I think that keeping up to date is really important. Brilliant. Thank you ever so much for joining us. And it is a fascinating topic with a lot involved that I think, you know, people might want to delve into a little bit more. If you are interested and you have been affected by any of what we've been talking about, then please do contact us and look on the website, and we will be able to guide you to the best resources or the best place to go. Thank you for listening to us. If you found interest in what we've been talking about and it's of value to you today, then you're going to see a link somewhere that comes up on one of these areas. Do pop a pound in the pot towards a charity to keep us going. We are a charity that support vulnerable young people in all age groups right up to the age of 24. Thank you for listening. Thank you very much for joining us, Laura.
Thank you.